I'm Dr. Angie Stamm.
And I'm Kayla McGuire.
And this is Integrative Connections, a wellness community for pets and people.
Welcome to Integrative Connections podcast. I'm Dr. Angie Stamm, and today we're welcoming Dr. Michele Wilkerson, naturopathic doctor from California, Folsom, California, originally, to talk about a variety of different topics, including prolotherapy, IV nutrition, supplements, food sensitivity testing, and whatever else we deep dive on. She's actually a good friend of mine, and we've had a lot of great times together, but we've never really sat down just to focus on talking shop because we usually get a little sidetracked talking about scuba diving or whatever. So I'm excited that you're here. Thank you.
Yeah, absolutely.
Can you tell us a little bit about your background in your path to becoming a naturopathic doctor?
Yeah, so it was kind of a combination of things. My mom was sick from the time I was very young, and she had this wonderful MD, and she was super impressed with him because he always had her on the newest, best medication that was out. And then he always, as soon as there was a big class action lawsuit showing that medication was causing liver or kidney damage, he had her right off of it, and he was on top of all of the latest science. And I watched her get sicker and sicker and sicker until she died at 65.
Ooh.
Yeah. At the same time, my father was a Vietnam veteran, combat veteran, and we would go on walks, and he would go, "Oh, that's mint. You can make tea out of it. Oh, that's wild grape. You can make," so we would be talking about these like herbs and things that you could use as basically wilderness medicine. And I was like, maybe if I could go to medical school and then I could find some Native American First Nation shaman or something that still remembers some of this medicine, and maybe I can bring it back to Western medicine, and then people can go back to being naturally healthy.
So you knew early on there was another way.
Right.
Yes.
But it was when I was applying to medical schools, I came home for Christmas and was telling a family friend this, and she was like, "I have a doctor that already does that."
Like, wait, what?
Yeah. So I actually went to an appointment with her, and I met Dr. John Trowbridge, and he was like, "Yeah, naturopathic medicine." And as soon as I had the word to Google, I had the schools to go to.
Awesome.
And I completely changed, my trajectory.
Very cool. And so you graduated with your naturopathic degree, and then you soon after started a clinic. Not too long after started a clinic, right?
Yeah. So I had a little bit of time to do some market research and figure out where I wanted to be. Ended up settling on the Folsom, California area because at that time there really wasn't anyone close by, and it was an area that was already interested in sort of moving in that direction, but had no one to serve them. So I came out here and started my clinic actually in 2009, right when, things were getting crazy. Yeah. And I opened up shop right next to a coffee shop that was owned by the daughter of a Folsom, ex-Folsom police officer, and her husband was a Folsom police officer. So I had Folsom police coming into my office all the time going, "What is this place?" Because they kind of thought we were a marijuana dispensary. Apparently the seaweed that I decided on for the logo looked kind of, if you squinted and tilted your head, like it looked like a cannabis, a pot leaf, I guess. I don't know. It didn't even cross my mind. But yeah, we got so busy that I ended up having to call a friend of mine from medical school who was floundering, and I was like, "Please, I need help." She's like, "Okay, I'll come out 3 days a week." And from there, I realized just there was no mentorship. There were no residencies really available. So we built a residency program, and we started getting, clinicians in who weren't being well supported and well mentored. And by the time we hit our peak, I had 9 doctors and 36 staff at 2 separate locations.
That's a lot.
Yeah. HR in California isn't the greatest.
It's tough. It's tough.
But we're popping for a while there, right before the pandemic.
And so what were the scope of your services?
Well, what we realized very quickly is that if you focus on one patient population, you could get really good at all of the modalities of naturopathic medicine regarding that patient population. So we started hiring in clinicians who focused on those patient populations and training them really well on how to treat those people.
Okay.
So,
for example,
so we had a couple of people that only did cancer, a couple of people that only did Lyme. We had people that only did fertility and menopause and hormone balancing. I had people that only did mostly gastrointestinal stuff, and me in particular, I did pain and injuries, which, you know, got me really into prolotherapy, platelet-rich plasma, stem cell injection therapies.
or regenerative medicine.
Regenerative medicine. And then the intravenous infusion therapies were, I mean, just so broad spectrum, applicable to all kinds of different patient populations that obviously had to come on board.
Yeah. So you really are a leader in the integrative medicine space, which is awesome.
I really love watching people get better just right in front of your face. It's so cool.
It's great. So I think that the prolotherapy technique that you've honed your skill so well at, now you're actually teaching other clinicians, right? The prolotherapy. Yeah. And so how did you get introduced to prolotherapy, and why is it not more readily available and taught about?
Well, so first of all, the simplicity of stimulating the body to heal itself.
First of all, what is prolotherapy?
Okay, so prolotherapy, prolo is slang or short for proliferation. So when cells proliferate, it means that they are building upon each other. When you injure yourself, initially, the inflammatory reaction that happens oftentimes is overly inflammatory, which is why doctors tell you to ice, because you want it to be just enough inflammation to trigger the first phase of regeneration, which the first 4 weeks after you injure yourself, your body's working really, really hard to fix it. After that 4 weeks, the body goes, you know, I need to put resources towards other things. So it'll start laying down scar tissue, and you'll start getting kind of like a you get kind of a half-cocked continuation of the repair. But that first 4 weeks is really like the heavy-duty hotspot of where stem cells, blood, collagen, all of those things are depositing themselves and working really hard to fix the problem. You can artificially trigger that first 4 weeks using prolotherapy. So basically what happens is we create a precise, controlled re-injury to the area in order for the body to start back doing that first 4 weeks of repair. And then you hit that 4 weeks, and you can do it at 3 weeks, you can do it at 5 weeks. It's, you know, people's schedules change. It's not that rigid. Right. But what you don't want to do is get into that scar tissue.
So you really want to be retreating every 3 to 4 weeks until you reach that clinical.
Because scar tissue has about 50% of the flexibility and the tensile strength of healthy collagen. So when you get scar tissue, you don't get the flexibility. It's not as strong, so it can re-injure more easily. But if you can break up that scar tissue and you can get the body to go, oh, this is a new injury, and start doing that first 4 weeks of repair, you can get an injury back to 98%.
Amazing.
Yeah.
Amazing.
It's really cool.
So what are the typical types of injuries that you would treat?
So a lot of times what ends up happening with repeat use stuff is ligament laxity, right? So your collagen just isn't as tight. So if you imagine trying to tie up a bundle of pencils with a rubber band that's been sitting in water, right? When you stretch that rubber band, it just kind of goes crack, crack, crack. It's still a rubber band, but it doesn't snap back, and it's more likely to break, right? And then you tie those pencils together, and you don't tie them quite as tight as you would need to keep a solid bundle so that they kind of fall apart. It's the same thing with bones, right? So if there's not a nice, brand new snappy rubber band holding your knee from going side to side and front and back, it's gonna hurt.
Right.
right?
It's going to grind on the cartilage, create more inflammation in the joint.
Right. But what you can do is you can actually re-injure those rubber bands, right? The ligaments and tendons, so that stem cells and blood go to the area and regenerate the collagen that makes that rubber band nice and snappy.
So cool. And so, and I've had prolotherapy on my knee, and it was successful. And I've been actually doing prolotherapy on dogs and cats for at least 10 years with very good success for similar conditions, typically ligament injuries in stifles, shoulder tendinopathies, hip dysplasia, hip arthritis, those sorts of things.
Well, and the cool thing is the placebo effect, right? In humans, people, if they think they're going to get better, they're more likely to get better. But dogs, cats, they have no idea that they're supposed to get better.
Correct.
You just get to see the results.
It's pretty exciting. Yeah. And so typically what we use is dextrose, which is a sterile sugar solution. But when the doctor that did my knee, the doctor that worked on my knee actually used some zinc, some different minerals, zinc, and some other. So do you use dextrose, or did you?
So here's the deal. And one of the reasons that doctors who don't, so one of the first questions you ask me is, why don't people use this more often?
Right.
And the reason is it's not sexy, right? If you can make $50,000 off of a surgery and you get to slice somebody open, that's exciting.
Right.
Right? But when you're injecting something into someone and you have to wait for the body to do the work, it's just not that exciting and thrilling. The thing is, a lot of the prolotherapy research studies that have been done were done with dextrose, and then they used saline solution as the control.
Okay.
Anytime you inject anything into tissue, it creates damage.
It doesn't matter. It's just
creates proliferation.
Even just sticking needles in there, probably even just dry needles like acupuncture would be to a low degree.
Right. So as long as you're not injecting something like a steroid that's going to shut down the repair response and the inflammatory response, which is why a cortisone injection feels great the first time. Then the second time, it doesn't work for as long. And then the third time, it doesn't work for as long.
And then you have no joint left.
Well, and then all of a sudden, you're surgical. But what the surgeon doesn't tell you is that every time they injected cortisone, they did more damage to the tissue. And then they told the body, shh, nothing to see here.
Oh, yep.
Right? Whereas with prolotherapy, you inject the tissue and you're going, hey,
wake up,
body. Focus on this knee right here. We just heard it.
Yeah.
Right? So it's not sexy.
Right.
Right? And it doesn't give you that immediate.
It actually makes you sore.
I feel better.
It actually can make you sore for a few days.
Well, and that's actually typically a good thing, is that because your body is, number one, you're paying attention to it so you don't re-injure it because it hurts. Right? And number two, the body's paying attention to it and sending more stem cells and more blood to the area to fix it.
Right. It's so great. And it can be stacked with other therapies like ozone.
Yes, I love ozone.
So do you usually combine ozone with your prolotherapy?
Yeah, it depends on the person and it depends on the injury, but ozone, because it's a gas, when it's injected into tissue, so when you inject liquid into tissue, basically what it does is it creates a bolus in the tissue, right? So you have this hole, so you have this hole, this rip basically. And in some instances that's great. But with ozone, it just infiltrates between the cells. So you get this ozone gas, and ozone is an O3 molecule, right? So what you have in ambient air is O2. That's what you breathe. It's a fairly stable substance, but O3, super unstable. So when you inject it into tissue, it dissociates into single oxygen ions they cross the cell membrane so easily, and then the cell goes, I got this breath of air. I can do all these things, you know?
So it almost regenerates the mitochondria a little bit.
Yes.
And it creates that hormetic stress response to trigger the body's own healing mechanism, right? And ozone is so inexpensive and safe, and prolotherapy is very reasonably inexpensive therapy as well, compared to something like PRP or stem cells. So how would you rank the success that you've had with, each of those therapies, Prolo versus PRP versus stem cell?
Well, I use them for different things, right? So Prolo is great for ligament laxity. I use ozone only for Ehlers-Danlos syndrome, which is a genetic problem with collagen deposition. I have found that the bolus of Prolo is harder for somebody with EDS to regenerate and repair than that cellular infiltration of the fascia. They do way better with just ozone. PRP, okay, so you cut yourself, right? And you get a scab. That scab glues your tissue back together so that it can reassemble itself, right? PRP is concentrating the components of a scab out of your blood and injecting it into a rip or a tear that creates that glue that allows the rip or tear to knit back together. So I use PRP, and I do ultrasound guided injections. So for me, I know for sure, based on what I see on the ultrasound machine, just like you see baby in the belly, you can see ligaments and tendons and joints and bones. So if I see a rip or a tear, you can fill that thing precisely with PRP, and that glue, as long as people are compliant, because glue it's just like super glue. If you keep checking to see if it's glued together, it's not going to adhere, right? So you actually have to give it rest, yeah. But that glue, it's your own body, right? Yeah. It's concentrating the systems that your body already has in place to repair itself and putting it in the right spot. And that is a key. You have to put it in the right spot. You could put unicorn blood into somebody, and if you don't put it in the right spot, it's not going to do anything.
Yeah, right. So Prolo is going to be more for the chronic overuse, chronic stretching and weakening of the ligament tissue, ligaments and tendons, and PRP is going to be more for your bigger injuries or even more of an acute injury.
Rips and tears.
Yeah. Okay. And then do you do much stem cell therapy?
I have found that the technology that is legal in the United States for stem cells is less impressive than what you can get in other countries. The thing you have to be careful with is there are certain other countries that are using human trafficking in order to acquire the stem cells. So you have to do your research. But there are really reputable, good clinics in places like Mexico and Turkey and things like that do ethically source their stem cells, and the way that they source the stem cells is better than what you can get in the US. I'm not an advocate of bone marrow or adipose, especially in the United States. First of all, I've had so many patients go get bone marrow. They had their own bone marrow aspirate, and then they end up coming back to me and going, I am in so much pain from the bone marrow aspiration that I need you to treat that.
Oh, wow.
And then with the adipose, the enzymes that they use to break down the adipose tissue to get to the stem cells damages the stem cells. So it's like, what are we doing here?
Yeah. So you'd be more in favor of PRP.
For the price, right. I'd rather do, 3 or 4 treatments of PRP than one stem cell treatment, which ends up, being about the same price.
Gotcha. You have better results with that. Oh, yeah. And then do you typically stack other nutritional therapies along with the Prolo, or is it?
If the patient can do it. The cool thing about IV therapies is that you can give someone, everybody always talks about, don't take supplements because you just pee them out. That's somewhat true and somewhat not. You can build up a tolerance so that you do absorb more orally to certain things. But when you do things intravenously, it completely bypasses the gut and the liver. You don't have to worry about absorption. You're immediately getting that hit. Yeah. You can only physiologically absorb 1,000 milligrams of vitamin C per hour orally. Mm-hmm. I can give you 75,000 milligrams of vitamin C intravenously in 2 hours, and your body's just gonna
suck it up.
Oh, yeah.
And vitamin C, of course, is great for tissue healing. So,
well, vitamin C, interestingly, the reason it's called vitamin C is because it's the precursor for collagen.
okay, it's a building block for collagen. So you could, in theory, stack on vitamin C, IV vitamin C, along with your Prolo and PRP, and probably get better results. Okay.
Yeah, and if you're you're at a clinic that's already doing ozone, you can do it's called major auto hemotherapy. Now a lot of people are doing what's called EBU, but basically you can treat your blood with ozone and reinfuse it. If you imagine that a red blood cell is like a bus, right? And each bus has 4 seats on it. And each seat can either carry an oxygen molecule or a carbon dioxide molecule. The body isn't 100% efficient. So you can hyperload oxygen onto any empty seats when you treat blood with ozone and reinfuse that into the body. And it's just, again, that big breath of it's like training at altitude.
Right. Yeah. And then that's going to stimulate the body's own repair mechanisms more efficiently, basically. Yeah. So
it's also antimicrobial.
The ozone is, yes. And antiviral. Right. Do you use ozone as a sole modality often? Or are you usually stacking that with others?
It depends. You have to be careful with people who have bloodborne pathogens like Lyme disease, because when you do ozone intravenously, because it is an antimicrobial, if you kill too many Lyme particles and reinfuse that into the body, you end up with this massive mast cell activation, and people can't tolerate it. Okay. So it's
depends what you're treating.
Yeah.
Okay. So,
and you don't want to pair oxidative therapies with antioxidant therapies because they cancel each other out. So like you don't want to do an IV ozone and then do a bunch of glutathione.
Or vitamin C.
Right.
Well,
and vitamin C is antioxidant below 25 grams and oxidative above 25 grams.
Got it.
So
depends the dosing that you're using.
Yeah, you also need to have a provider that understands that.
Gotcha.
Yeah, this is why MDs who are like, oh, it's just natural, end up hurting people because they don't get it.
Right.
They just don't have the training, right?
Right.
I applaud them for trying. They don't have the training.
So the practitioners that are do you think that prolotherapy is here to stay, and are there a lot of practitioners that are really wanting to learn this technique?
It's been around for so long. It's not going anywhere, right? And what I find is that the providers that often end up coming to the technique are providers who couldn't find solutions for themselves within the Western medical paradigm.
Got it.
And found this, got better, and now want to, they
didn't hear about it through the grapevine. Nobody's talking about it. It's kind of
sounds sexy.
It's kind of this under the radar thing. Mm-hmm. I recommend it to my patients all very often, and the vast majority have no idea what it is. Never heard of it. So it'd be nice to kind of just give them this podcast to listen to, and then they can learn more. Yeah. Can you talk expand a little bit more about your IV therapies that you offer in your clinic or were offering, and what your favorite ones and most profound benefits that you would see?
Yeah. Well, I think it's important to talk about too, because there's a lot of pop-up IV clinics that they're doing good things, but the dosing that they're providing is either not robust enough to be therapeutically applicable to people who are really needing a specific thing treated. The pop-up clinics oftentimes, you get a liter of saline and, 1 cc of 1 milligram of B12 and whatever, which is fine for a healthy person who just wants to be hydrated, but I mean, they could also drink water. Right. It's great for a bachelor party or whatever, because you're challenging your body. But if you really, so for patients with that have had bariatric surgery or have severe IBS that are not absorbing their nutrients orally, the issue with the gut is that when you eat, your gut has to absorb the nutrients into the bloodstream. The bloodstream has to get it processed through the liver and then re-delivered to the gut via the gut's blood supply in order to feed and heal the gut. So if the gut is either leaky or damaged, or you have, bacterial overgrowth, or you've had a bariatric surgery that literally cuts off the part of your gut that absorbs certain specific nutrients, getting those nutrients intravenously can be a game changer. Because what it does is it actually gets you to the point where your gut can start absorbing those nutrients.
Yeah. I'm familiar with a lot of the different vitamins that are used, the B's and C's. And what about minerals? You use a lot of IV minerals?
Yeah.
Primarily like magnesium or?
So there's a multi-mins combo. Magnesium, calcium, potassium is a standard. Zinc is a standard. Certain nutrients can't be combined in the same bag, or they will interact so quickly that you don't get the benefit in vitro or in vivo. So you have to, sometimes we do like a piggyback. So basically it's like you infuse one thing and then you put another bag on and you infuse the new thing, and it has to be kind of sort of maneuverable. And then certain doses you have to dilute into larger amounts of solution and things like that. So your doctor should know and be trained on that. But there's almost nothing that can't be done intravenously except for some fat soluble nutrients. Like vitamin D, you don't want to do intravenously, but you can do it intramuscular. Same thing with CoQ10. So that's, but you can, if you do need those higher doses and you don't, can't do them orally or aren't getting the benefit orally, as an intravenous infusion or an intramuscular injection, that can be great. And I know a lot of people are squeamish about needles, so that can be a stopping point for some people, but the benefits are just so undeniable that when people feel the difference between taking something orally versus getting it injected or infused. I remember when I was brand new baby doctor, first in clinic, swine flu had come out, and I had just hired a new front office staff person, and she came in looking like death. We did a little baby Myers cocktail, tiny IV of vitamin C, B vitamins, 1 or 2 minerals, and she went from looking like she was on her deathbed to looking like she had put on makeup and was ready for a photo shoot within about 30 minutes.
Amazing.
It's striking how quickly effective these things can be.
Yeah. And do you treat yourself typically?
Oh yeah.
What's your go-to?
I love NAD injections. I love them.
Even though it kind of make you feel a little wonky while you're getting it?
Well, so here's the thing. The way I describe this to patients is like, if you imagine, because mitochondria is the engine of the cell. If you imagine a car engine that has 0 gasoline in it, right? When you put new gasoline, it's gonna cough and sputter, and as it's getting the gasoline through the engine and through the system before it can actually rev up the engine and get it working, you're gonna have that kind of like, whatever.
A little jittery.
Yeah, when you do NAD for the first, 1, 2, 3 times, you're gonna get a little bit of like palpitations, a little bit of whatever if you're depleted. Once you start doing it regularly, you're just gonna get that hit of energy, and it's like having 8 cups of coffee without being like jittery, shaky, anxious. It's just like, I feel good.
That's amazing. Great.
Yeah. NAD with B12 is, you can wake up feeling like death, and within 15 minutes, it's like...
You have your stash at your house, I'm sure. I'm coming over next time I'm hungover. Michelle, I'm hungover.
Well, it's funny because when I was running my clinic, I could tell when the staff had a rager the night before, because they wouldn't call in sick after a while. They would just come in and give themselves a shot.
Well, it's great.
Their hours. Yeah.
So what would be give us a case study, maybe if you can think of any patients that had some great success circling back to your prolotherapy and or PRP treatments.
Gosh, there's so many. Yeah. I was just lecturing at a conference in Orlando last week. And I love this particular conference because there's a couple of things that happen there that don't happen at a lot of other conventions. One is that they have practical breakout sessions. So we will treat each other and teach each other. And then they also have a cadaver section where you can go in and you can practice on body parts. So they'll have like a shoulder or they'll have a knee, and it's just parts of cadavers, which is really cool too, because then you can practice looking on ultrasound and like getting the needle guidance to go to the right place and things like that. But anyway, I was at this convention that I lecture at every year, and I had a doctor come up to me that I didn't remember or recognize. And he was like, "You treated my shoulder last year and it's perfect. Oh, one treatment. Wow. Done." I was like, "I don't remember him."
Well, you're famous.
Right.
That's great.
Yeah, so it's just, and I've had patients that expect the cortisone effect. I remember I had one particular patient that expected the cortisone effect. I did his elbow.
So that immediate relief. Yeah.
And he called the office and screamed at a medical assistant about how I charged him all this money and he was in pain and it was worse than it was when he came in and blah, 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 blah. Same patient called a year later and said, "So I'm really sorry, but my elbow's better, and would you treat my brother?"
Oh, I had a dog last week that I treated with prolotherapy. It's an overweight older golden retriever with chronic cruciate ligament tears in both knees. One's worse than the other, and then subsequent arthritis from that. And she had a series of 3 prolotherapies last year. And she did really well for a while. And then he came back and, "Oh, she's really struggling. She can't go on her walks anymore. I'm thinking about putting her down. What should I do?" I'm like, "Let's do another prolo on her." Dog's 1 week. Dog's bounced back. She's like, "It's great. We can go for our walks again. Everything's fine." Mm-hmm. No NSAIDs, no pharmaceutical. And the NSAIDs don't really work that well anyways, right? So
it's a Band-Aid.
Yeah, it's a Band-Aid. So it's pretty exciting. And I do find, like, for the dogs and cats, over time, with prolotherapy, especially for a ligament laxity, you will have a restretching effect with that rubber band, and then you have to do kind of like a tune-up oftentimes. I find with, once a year, we kind of tend to do a tune-up, and that seems to be pretty effective. Do you find that with people too, that you need to retreat?
Yeah, that's a big question. A lot of people always ask me, how long is it gonna last? Yeah. Right? So here's the thing, is we age. We go do fun things. We are active. So what I tell those people is, you go break it, I'll fix it.
Yeah. Totally. Don't wrap yourself in bubble wrap.
Right. Yeah. Go live your life, enjoy your life, but you are going to wear it back down. Right. It's not, so we have reversed the damage that you did. You're going to go do more damage because you're going to go have fun and live your life.
If you're a dog and you don't have any self-regulatory function, you're going to go bounce around and jump off the bed and
chase balls. And if you feel good, you feel good. Right. Use it. Enjoy your life.
How I, when clients ask me how many treatments are we going to need or how do we know when to stop, I just do it to clinical response. As soon as they're not limping anymore, you're happy, we stop. When they start limping again, they're sore again, then we resume. Yeah. And I think that's reasonable. Yeah. Right?
With people, what I tend to do is give them the option, because if I look at them on ultrasound or I do a physical exam and I'm like, okay, you're 98% better. Right. You're probably going to continue to improve if you're gentle with yourself. But if you feel good enough that you're going to test it, and you're going to push it, you're probably at the point where you could easily re-injure it if you're not. So I give them the choice and say, do you want me to hit it again to get it to the point where you really can play?
Right.
Or would you rather chill out for another 2-3 weeks and then you know, we'll go from there? And I give them the choice.
Sure.
You know, because some people are like, no, get me to 110%. I need to get back on the football field. And some people are like, you know, I won't go marathon shopping for the next 2 weeks or whatever.
I had a case, a cat that had bilaterally ruptured, not fully ruptured, but very severely damaged Achilles tendinopathy. Yeah, and I think it was subsequent to a monoclonal antibody treatment that we were doing for pain for nerve growth factor called Silencia, which has potential side effects. They were not approved for people for this reason. So anyway, the cat basically was walking down on its hocks, like the hocks were on the ground. And a couple of prolotherapy treatments, it's like walking around happy. It's amazing. So pretty cool.
Yeah, that's awesome.
Yeah. And safe, inexpensive treatment. Western medicine doesn't really have any options for that. They're like, whatever.
Yeah. Yeah. Well, and if they don't know about it, it's also not part of medical training. Right. It's the only reason I really got into it was the second year I was in medical school. 7 or 8 of the faculty of my medical school were pulling someone in to do a weekend training, and I'm an opportunist if I'm nothing else. And I was like, I can get you models. we can be your test dummies.
Nice.
So we got to take the training and, you know, let the doctors practice on us. Okay. So that's one thing that a lot of people are really surprised about, and it just seems like logical to me, is any doctor that you've ever seen, ever, has practiced the therapies that they do on you on other doctors first.
Okay.
Always. So that's how we learn, is we treat each other, give each other feedback. Sure. I mean, I've got a video of me, my butt's out and getting injected in the hip. There's a needle and syringe just kind of flopping around in my back. And I'm talking to the doctors that are standing around about how it feels and what's going on, while the doctor who's injecting me is showing on the ultrasound machine what he's doing and why. And it's
awesome.
how we learn how to do it.
Crazy doctors, you.
I mean, you gotta figure it out.
So do you use prolotherapy on disc injuries? Can you use it on the spine?
You can.
It's a little bit more risky though, right?
Yeah, no, I mean, as long as you're not going, you know, up towards the head, it's really not. Okay. Like the spinous process of the spine is there to protect
the cord.
Yeah, the spinal cord. So it's really not risky.
Isn't disc disease from ligament laxity, like a lot of times?
It can be. But I would recommend, if you're gonna do injections in the spine, find somebody who has fluoroscopy, because
you really want to be accurate with your needle placement, right?
Yeah, and with ultrasound alone, you can, as long as it's you know, the transverse ligaments or the spinous ligaments, you can get some improvement. I see better improvement with ozone because it infiltrates a lot further. Okay. But it takes a long time. It takes a lot of treatments, and you just have to be prepared for that.
Be patient. Mm-hmm. Yeah. So you like ozone primarily, ozone gas for disc disease primarily. Okay. And you get good results with that, not PRP.
It depends.
Yeah. Depends what kind of injury it is. Yeah. Okay. Let's segue into nutritional supplements. I know that that's a big pillar of what you do. What are some of your favorite lines and favorite products that you tend to use a lot?
I really like Thorn. I really like Herbal Vitality. Vital Nutrients is a good one. Orthomolecular products, their formulations are really good. Pure Encapsulations is pretty good. Their doses are really high, so a lot of times people have to sort of work up to tolerance. But yeah, I mean, there's some really good lines out there. Forms are really important. So
The form of the molecule.
yeah. So, I mean, I've had people, I had a lady come up to me. This is why I don't tell people I'm a doctor in public. I had a lady come up to me at a baby shower after not 3 glasses, but like a glass of champagne, whatever. Which that's another thing when I treat friends, I'm like, okay, this is a hard rule. I don't want feedback. I don't want reports about any of your healthcare stuff in public. You have to come in for an appointment because I won't remember. I've got 800 active patients. If I'm not sitting there typing at the same time as you're talking, I have no idea what you told me. What do you mean? We're friends. Anyway, I had this lady come up to me at a baby shower and was like, so me and my book club, we're getting really interested in magnesium. What do you think of magnesium?
Such a general.
That's like asking me what I was, scrambling. I was like, that's like asking me what I think of grass. What kind of grass? What kind of magnesium?
How much?
Magnesium oxide, magnesium taurate, magnesium glycinate, magnesium chelate. What are we talking about here? And she kind of, yeah, it was not a good conversation. But the form really matters. Sure. I've had people who are very, very intelligent people who are very proud of the supplements, and I have them bring them in to the clinic. And you pick up a bottle of fish oil and open up its smell and it's rancid. It's like, give that to your dog.
No, or don't.
Or don't.
Don't give it to your dog.
You don't want to throw it away. Okay, don't give it to your dog. No, but you smell.
I like Nordic Naturals, by the way.
Right. I love Nordic Naturals. Nordic Naturals is great. No, Nordic Naturals is a really good line.
Yeah.
And the thing with fish oil too is it's is it an ethyl ester or is it a triglyceride form, which they don't put that on the bottle, okay. Right? So a lot of times what they'll do to filter out
mercury
mm-hmm. is they'll break off the triglyceride backbone and the ethyl ester legs of the molecule. They'll filter that and then they never put the triglyceride back on, and your body doesn't process it or utilize it as effectively, whereas Nordic Naturals will put the triglyceride backbone back.
Okay, I didn't know that.
Yeah. That's one of the reasons.
More bioavailable form.
Yes, exactly, because your body recognizes it as food.
Right. Got it.
And I've had people come in and they're like, I'm taking magnesium for my blood pressure, and it's magnesium oxide, which is basically, it's a laxative. It doesn't get into your bloodstream at all.
Right.
But it was cheaper than the other magnesium that they saw on the shelf, so that's the one they got. Right? Well, that's why it's cheaper, is because it's a laxative. It doesn't do anything for your blood pressure. So yeah, I would say that's one of the biggest things, that actually getting a professional that can make recommendations of supplements that are specific to your needs, mm-hmm. and do an intracellular nutritional analysis.
Okay, tell us about that.
SpectraCell Labs, basically they take your white blood cells and they grow.
You did this on me, by the way.
Oh, okay.
You don't remember because we just had that.
Because I have 800 activations. Yeah, but no. So what they do is they put your white blood cells on a petri dish, and each petri dish is missing an essential nutrient. Okay, so imagine that you were dropped off in the middle of the woods with a backpack full of all of the things that you need to live, but that backpack doesn't have any vitamin C in it, right? So that those white blood cells on the petri dish that has no vitamin C, they're all gonna die, right? Versus the white blood cells that are on the petri dish that have the magnesium, potassium, whatever you have in your backpack. So what it does is it tells you in a nucleated cell what specific nutrients are there and readily available. Because if you just do a blood test that's serum, it's just going to show you what you had in the last 48 hours. If you took vitamins in the last 48 hours, you're going to look great. It's not.
It doesn't tell you cellular absorption, right?
Exactly.
Okay, so intracellular nutrition testing is one thing that you like to do, and then you'll pick your supplements based on that.
Yeah. Yeah. And there's testing out there that looks really like overwhelmingly scientific and fancy, but doesn't give you actual information. So beware of those like 30-page packets that are very impressive, but can't actually tell you what's going on. I like Spectracell.
Okay.
I think it's a good company.
And what about food sensitivity testing?
Food sensitivity testing is interesting. So IgE is the immunoglobulin that's like the immediate reactivity things. Most adults know what they react to right away. So you don't really need to do IgE testing.
Okay. You're going to know if you feel crummy.
Yeah, if you're allergic to peanuts, it's going to happen right away.
Severe allergy. Right.
But IgG, so that's the delayed reactivity, that slow buildup of inflammation.
You might not notice it right away, but it's not making your body happy.
And the thing is food sensitivities is not always my tummy hurts, right? It can be migraines. It can be joint pain. It can be fatigue.
What about if you're just bitchy?
Exactly. Well, and that was the next thing I was gonna say. Is I had a teenager once who he was like, I used to be angry all the time, and
But all these bitchy teenagers just need B vitamins.
right. And when I cut out gluten,
Yeah.
right,
Or
whatever, and we actually used to run around the clinic and be like, I got another one, because all of these teenagers that are on Adderall are freaking they're iron deficient. They just are not getting enough oxygen to their brain because there's not enough iron in their red blood cells to hold the oxygen and bind it.
So I'm going to take a little side note and we'll come back to that. But my daughter is 19. She just donated blood and the lab sent her a note back that her ferritin is at 9. And she's really tired. Go figure. And so that makes me think, well, what is it? Obviously you can supplement with thorn iron, right? But is she going to absorb it, and what's the root cause of that? And how would you, like, for in that kind of case, not to like ask for free medical advice, but like how would you approach that case? Do you think that there could be a parasitic cause? Do you think it could be a food sensitivity cause? Do you think there could be a leaky gut issue?
Well, first of all, teenagers have terrible diets.
Yeah.
And they all think that being vegetarian means...
No, she eats a lot of meat.
Does she?
She's in Montana where they have good meat too. Mm-hmm.
So you would want to check her for a thalassemia, because giving her iron in that instance is going to make things worse.
Okay.
Yeah, I mean, there's so many reasons. Heavy metals, oxygenation, B vitamin absorption, vitamin C, all of those things work together to put iron into the red blood cell. And a lot of times, hormonal imbalances creating ultra heavy periods in young women in particular will create this transient anemia where it's like, you don't have PMS, you're just anemic for a week out of the month.
Okay. So that's a whole rabbit hole discussion.
Can be.
But back to food sensitivity testing. Do you like to do saliva or blood tests, or what's your favorite, most accurate test that you found for food?
I use US Biotech, and it's a blood draw. Okay. That's the one that I have found to be most consistently accurate. US Biotech.
US Biotech.
Really the one that I have found to be the most accurate and the one that gives me the most confidence. The other thing that you need to know, though, is that if you have leaky gut, everything's going to blow up.
Right. Especially the foods that you've been eating recently, right?
Yeah.
Don't we all have leaky gut to some extent?
To some extent, but I mean...
That's not what you find. You don't find that everyone's reacting to what they just ate.
Right.
Okay. So, but if you get a food sensitivity test and it's got lots of things on there, then that's a sign. Yeah,
well, and I've found too, I've had a couple of patients that have come to me from people who aren't properly trained on this either. And they're like, well, I cut out the foods that were high on the test and then I retested and they came back low, but I ate the foods and I had the same reaction. Here's the thing, is it's kind of like taking a tetanus shot. Right? So you take a tetanus shot and then your immunity to tetanus wears off over 10 years. When you eat foods, If you stop eating those foods, your immune reactivity wears off over the course of a month or two. So if you take the test and you haven't been consuming those foods, your body's not going to dedicate immune resources to attacking something that it's not experiencing.
And that makes sense.
So retesting food allergies a couple months, a month or two, whatever later,
doesn't really help you.
It's a waste of money.
Okay.
I did have one patient who was like, I want to do a food allergy test every year and not come see you, and I'm just gonna take the test. And I was like, well, you're wasting your money by not coming and seeing me so I can explain to you why you're wasting money on this test. Come on.
Okay, so how often would you typically do a food sensitivity test then? Every 5 years?
I mean, unless you're dying and really missing a specific food,
Just stay off of it.
just stay off of it. Yeah, if you really, really are missing a specific food, then I would say load up on it for a month, and then we'll retest you.
Okay.
And let's see if your immune system...
Have it once in a while. It's probably not a big deal.
Right, and that's the thing is if it's off the charts, you need to stay away from it. If it's just kind of a blip, it's like, just don't eat it every day.
Yeah.
Just stop eating it every day.
Okay. Good to know. Can you talk a little bit about your decision to shift gears in your career?
So while I was running my clinic and seeing patients full-time and being a business owner and a boss full-time, I was also lecturing at conferences, and I was also going to clinics all over the country and teaching them how to build what I had built. So I kind of got to a point where I was like,
Too much.
Yeah. I really like teaching other people and watching them thrive and succeed and treat patients using the techniques that I'm teaching. I had the opportunity to sell the buildings. I had the opportunity to kind of piecemeal sell the clinical practice, and since then I've just been teaching other clinicians. And it's really nice. Recently, I've kind of gotten dragged back into covering for people who have needed sabbaticals or family leave or whatever. And so far, I've only done that for friends. But I could see myself, I do enjoy seeing patients. So I could see myself offering to go into clinics for a week or two and just do
Injection therapies or...
Yeah, just do procedures. I don't want to do consulting. I don't want to do recommendations. I don't want to mess with treatment plans. I don't want to acquire new patients. I don't want to poach patients from existing practices, which is a lot of times what happens when doctors go on vacation, is they'll recommend that, hey, you need IV therapies. Here's this clinic down the street. Go to them for 2 weeks, and then they never come back. So it's like, I have no interest in, poaching patients. I have no interest in diagnosis, treatment, recommendations.
Sure. You have all this basis of knowledge, so it's great that you can share that with everyone. Yeah.
So if I can pop in, pop out,
And you'll still do your lecturing and prolotherapy. Yeah.
I like that stuff.
Yeah. That's awesome. Is there anything else that you can think of that I've missed in terms of your different modalities that you really love to incorporate? Peptides. There's nothing really else. We kind of covered your basic tenets of the way you like to treat, right?
Yeah. Peptides are frustrating just because the California Pharmacy Board likes to be like, you can have them, no you can't. You can have them, no you can't. Oh, and then patients will be like, well, I can get them from this lab on this website, but it says that it's not for human use. It's like, yeah, you can do that, but I can't do that for you.
So that's tricky.
Yeah, it's too complicated, and the basics work.
Yeah.
So, getting on a fad bandwagon just because it's new and sexy is like, the basics work.
Totally. Yeah. Awesome. Well, thank you so much for being here with us today.
Yeah.
And sharing your knowledge. We appreciate you.
Yeah, absolutely. I hope that this gets out to people who need it and helps a couple people. If that,
Animals too.
and some animals too. Yeah.
Awesome.